Hello students, today we are seeing the second topic, that is from the upper limb, that is the upper axilla. Okay, so what is axilla? So axilla or a armpit, it's a pyramidal truncated space between the upper end of the arm and the chest wall, medial chest wall. So this is the connection between the neck and to the upper limb. Okay, so as it is a pyramidal, it consists of an apex, base, lateral wall, medial wall, anterior wall and a posterior wall. So we'll see each wall in detail first. So first one we can see the apex. So this part is the apex. So apex, it is also known as cervico-axillary canal. So this cervico-axillary canal bounded anteriorly by the clavicle, medially by the outer border of the first rib and posteriorly by the scapula, upper border of scapula. So this is known as the cervico-axillary canal. Okay, so through this cervico-axillary canal, axillary artery and brachial plexus enters to the axilla, and the axillary vein joins with the subclavian vein and continues as the subclavian vein through this canal. So that is the apex of the axilla. Now the base or the floor of the axilla, we can see here, this is the skin. So this part, it is the skin, then the superficial fascia and the deep fascia, which is known as the axillary fascia. So that forms the base of the axilla. So the apex and the base of the axilla. Fine. Now we can see the anterior wall of axilla. Okay. Now the anterior wall of axilla we can see. So this is the pectoralis major. So pectoralis major, which forms and fold, that is the anterior axillary fold. Okay. Now if I remove this pectoralis major, deep to this we can see this is the pectoralis minor and the clavipectoral fascia. So this much it forms the anterior axillary wall. So now inside we can see the axilla very clearly now here. Now posterior axillary fold or the posterior wall of the axilla we can see. So this muscle, this is the latissimus dorsi. Behind that, here it is the teres major. Deep to that there is the subscapularis muscle. So from anterior to posterior you can see subscapularis muscle, teres major muscle and the latissimus dorsi. And this latissimus dorsi and the teres major, which forms the posterior axillary fold. Here you can see the posterior axillary fold. Okay, so that forms the posterior wall of axilla. Now the lateral wall, it is most the narrowest part, which forms here, that forms the surgical neck or the shaft of the upper part of the shaft of the humerus with the bicipital groove. Within the bicipital groove we can see the tendon of biceps and the coracobrachialis muscle. Now when you see the medial wall, so here this is the medial wall. Medial wall you can see there is the upper four ribs with the intercostal space and muscles, along with the upper four digitations of the serratus anterior muscle. Clear? So this is about the boundaries of axilla. Now we'll see the contents of axilla. So boundaries I told: anterior wall, posterior wall, medial wall, lateral wall, apex and the base of the axilla. Now we can see the contents of the axilla. So here the first, the medial most content, we can see this is the axillary vein and its tributaries. So you can see the cords of brachial plexus. We can see this is the cords of brachial plexus. So these are the cords, even and then we can see this is the axillary artery. So three structures I will separate. So this is the axillary artery and the branches and cords of brachial plexus, and next it is axillary vein. So these are the major contents: axillary artery and its tributaries, branches of brachial plexus, then cords and branches of brachial plexus, axillary vein, and one nerve we can see here, that is the intercostobrachial nerve. Intercostobrachial nerve, we can see it is arises from the second intercostal space, and one more nerve we can see here. I just pointed the one nerve, so this is the long thoracic nerve which supplies the axilla, sorry, the serratus anterior muscle, long thoracic nerve. Okay, so these are, and then the fat which I removed from this axilla, so fat, then the axillary group of lymph nodes. In the axillary group of lymph nodes, there is anterior, posterior, lateral, apical, and central group of axillary group of lymph nodes. So these are the contents of axilla. Now next, the topic in this, we can see the axillary artery. So we can see this is the pectoralis major. We removed the pectoralis major. Now we can see the pectoralis minor. So this pectoralis minor divide this artery. Okay, so we can see it very clearly. So this is the axillary artery. You can see the axillary artery very clearly. So the axillary artery, to visualize more, I can just remove. So this is the cephalic vein and one tributaries of the axillary vein. So I'm not removing that. Anyway, we will keep the cephalic vein intact. So you can see here, this is the axillary artery. So this pectoralis minor muscle divide the axillary artery into three parts. So that is the first part proximal to the pectoralis minor, one second part deep to the pectoralis minor, third part it is distal to the pectoralis minor. So now, so deep to the pectoralis minor. So these are the three parts of axillary artery. So we can see the three parts. So this is the first part, and deep to the pectoralis minor is second part, and here it is the third part. Okay, now we'll see the branches of axillary artery in each part. So here the first part, you can see, I will just lift the axillary vein. So you can see one branch here. See, this is the one branch, that is the superior thoracic artery. So you can see there is a superior thoracic branch. See, this is superior thoracic branch, that is from the first part. Okay, now the second part, you can see this is thoracoacromial artery. Thoracoacromial artery from the second part, and one more here deep to the pectoralis minor. So here you can see that is the lateral thoracic artery. Okay, so the two branches from the second part. Now the third part, you can see the largest branch of axillary artery. Here you can see this is the largest branch, which is, so you can see the largest branch, that is subscapular artery. See, you can see this is arises from the third part of axillary artery. So this is the subscapular artery. So subscapular artery runs along the lower border of subscapular muscle, and it gives a branch here that you can see the circumflex scapular artery enters into the spaces, scapular spaces. Now if you see the relations of the axillary artery, you can see the axillary vein throughout the lung, it is medial to the axillary artery. Okay, now if you see the first part, the anterior relation, it is pectoralis major, then clavipectoral fascia. So this is the anterior relations of the first part, and the medially to the medially in the first part, that is axillary vein, and here it is related to the cords of brachial plexus. The lateral and the posterior cord situated on laterally, and the medial cord situated on posteriorly. So this is how the arrangements in the first part. Now if you see the second part, what happens in the second part? Anteriorly there is pectoralis major, pectoralis minor anteriorly, then medially there is the axillary vein and medial cord, and laterally there is the lateral cord of brachial plexus, and posteriorly posterior cord of brachial plexus, the respective cords to the respective sides. When it comes to the third part of axillary artery, here you can see throughout the medially there is the the axillary vein. Along with the axillary vein, medially you can see this is the ulnar nerve and the medial cutaneous nerve of forearm. Then anteriorly you can see there is the median nerve, then pectoralis major muscle, and laterally you can see this is the musculocutaneous nerve. If you see posteriorly you can see there is the axillary nerve and the radial nerve. Okay, so this is the relations. In the branches, I forgot to tell you, in the third part there is subscapular artery. Along with the subscapular artery you can see the two branches. This is the anterior circumflex and this is the posterior. So here you can see this is the anterior humeral circumflex and here it is posterior humeral circumflex and the subscapular, that is the third part branches. So I told the relations, laterally musculocutaneous nerve, medially the axillary vein and the ulnar nerve and the the medial cutaneous nerve of forearm. Anteriorly you can see the median nerve, and posteriorly there is the radial nerve and there is the axillary nerve. Okay, so this is the relations. When it comes to the posterior relations, you can see the throughout the length almost there is the subscapularis muscle, teres major muscle you can see on the posterior aspect. Fine. So this is the axillary artery. Just I will revise the branches of the axillary artery once again. So this is the first part. From the first part there is one branch, that is the superior thoracic artery. From the second part, that is deep to the pectoralis minor, thoracoacromial artery, and there is the lateral thoracoacromial and lateral thoracic artery. And from the third part, it is subscapular. There is the largest branch, that is the subscapular artery, and anterior and posterior circumflex humeral artery. So this is about the axilla and the axillary artery. So along with this, there is the axillary group of lymph nodes. So thank you.